What's up, guys? Today we are going into part 2 of removing hip pain and knee pain, but this one more specifically regarding the hips. So if you came on yesterday and got into the mobility with the joint flexion gapping with the ball behind the knee there, using the wall to leverage the ability to separate kind of that knee joint, provide some better motion in there, and also kind of hit behind the lower leg, just above on the calf on the inside and outside there. You might have opened up some stuff, but we didn't really get a chance to dig into the hips all that much. So today I thought we'd do a better job and just really dig into it. So first thing we want to assess, guys, is, and one thing I haven't really talked about is understanding that what's nice about what we're doing is everything can be broken down based on, are you moving well with your functional movements? So the first movement that we want to look at is going to be kind of our hinge pattern, right? So everyone that comes in, when we start out, right, we don't want to teach ourselves how to brace our bodies, and then we simply learn how to hinge here at the hip without flexing or moving the spine. So what we're trying to think about, right, is what would be some reasons that I wouldn't be able to do this properly, or it would hurt me, or it would cause back pain, okay? And one of those reasons is, yeah, it could be short hamstrings. Yeah, it could be that we're just learning the movement. But one of the reasons is that sometimes we get gunked up in this hip capsule, right? If I'm sitting down all the time, applying pressure here, matting down these tissues, then what happens is this femur head gets pushed forward, okay? And like this glute gets all locked up, and we're not able to effectively let this femur have this nice natural gliding motion as I sit back. So I might go to deadlift and I just don't feel like I have any room to push my hips back and down into my actual hip socket. So how do we open that up? First thing we can do is going to be, and again, I'll keep this with minimal equipment right now, but if you want to, I'll give you the gym version afterwards too. So the first thing we want to do, guys, take our trusty mobility ball, and what we're going to do is we're going to just stick it on the ground here. Effectively, what I'm going to try to do, guys, is I'm going to try and get it into my butt. How was that for a close-up? Okay, so what I'm going to do is I'm going to go ahead and put it on the ground here. I'm going to get seated right on that puppy. Okay, if you can take a look here, it's right under the hip. That's where I want to be. Now, my setup with my position here is I'm going to have this leg kicked out to the side. That's opposite. I got this hand opposite of this leg as my stability points, and then this leg is just kind of floating out in space. What I'm going to do if I didn't have the phone in my hand is I would grab this leg that's out in space. I'm going to bring it up towards my chest. Oh, and that's going to expose that hip capsule to some pretty gnarly tissues. And I want to just go ahead and I'm going to make clockwise circles with this thing. Now, you're going to start to feel it open stuff up. Okay, I would say about 2-3 minutes per side. That's going to really kind of soften that tissue up. And again, if you find a hot spot, stay on it. Dig that stuff out. Okay. Second thing we're going to do then. Let's see if I can get this set up here. All right. Second thing we're going to do is we want to effectively use and leverage our own bony structure to open up this hip capsule better. So what we're going to do, guys, I'm just going to use this if you have a carpet at home or something to protect your knee. It can get a little funky. But what I want to do is I want to get into a position, and I'm going to try to wind up this hip capsule by internally rotating this leg, and I'm going to block it with this back leg so it can't go anywhere, okay? What I'm going to do now is I'm going to drive force down into the floor. That's going to essentially drive this bone up into my hip, and as I drop my chest down, it's going to continue to drive pressure into the hip. And I'm going to start to make, again, little clockwise circles here, and I'm starting to kind of open up and grind out some of that limited range of motion. I'm going to use my own bony femur to grind it out, okay? And I'm going to do this for probably 2-3 minutes aside, and I can explore. I can move to the side. I can move to this side. I can drop the chest lower, okay? It's all about personalization by understanding where am I tight, where am I missing range of motion in my movement pattern, okay? Now here's the fun part. Here's the key, actually. You got to come back and you got to retest. So if I just did this hip a little bit and I go to hinge, wow, you know what? I actually feel like I can sit back further than I can on this side. So of course I want to then repeat on the other side. And again, we go until we either reduce pain, until we improve our movements, right? Or until we see a specific change that we're looking for. I hope that helps, guys. Removing hip pain, part 2, the hinge pattern, opening up the back side of the hip capsule. We'll catch you back here for some more goodness very shortly. See you soon. Bye.